The federal government says it has recruited over 2,000 medical doctors, nurses, and community health extension workers to boost the nation's primary health care system. The coordinating Minister of Health and Social Welfare, Professor Muhammed Ali Pate, disclosed this during the 4th edition of the Ministerial press briefing in Abuja. Pate, who says the federal government is set to inject a 50 billion naira fund into the health sector, assured Nigerians of President Tinubu's commitment to ensuring improved health care for all citizens.
And we've had discussions with the Governors Forum, with the National Economic Council, and with the President's direction. We are tightening up the fiduciary system so that when we disburse 50 billion by the end of this first quarter of 2024 to the primary healthcare centers through the MPHCDA gateway or the NHIA gateway, the resources will indeed reach Nigerians and will be subject to social accountability measures so that we see the impact of those resources that are coming from the federal government's portion of the federation account. That's the 1% CRF. 2,497 doctors, nurses, and midwives have been recruited in our primary healthcare centers to fill gaps and to help in delivering services. And hundreds of thousands of Nigerians have been enrolled in the health insurance program through the National Health Insurance Scheme and the Vulnerable Groups Fund. We increased the quota for the schools of training of nurses and midwives. We doubled it. And we're working towards increasing that for other health cadres as well, so that we can increase the production of health workforce that we need. We know that in many parts of our country we're struggling with that. In addition, we spent time to build an approach to invest and renew the health infrastructure in our hospitals. Recently, as you are aware, the President approved, in fact, the infrastructural upgrades and equipping of 6 cancer centers in the 6 geopolitical zones in collaboration with the NSIA. That is in the 2024 appropriation of the federal government. In addition, there are 8 diagnostic centers and 2 oncology centers that the groundbreaking ceremony will be conducted very soon as part of the renewal of the health infrastructure in federal tertiary hospitals. And if
government wants to reduce cost, also improve efficiency in service delivery. Now, this does not necessarily mean that government is out to retrench or to throw people out of the labor market. That is not the original intention. The intention is that efficiency has to be brought in, because some of these parastatals are actually having some overlaps in the way they do their operations. So all these things are we feel that we should all remind you about some of these things so that you see what government is doing to ensure that Nigerians get the benefit of the democracy.